Welcome. Now that you have started network spinal analysis chiropractic care, we wanted to share some of the basic physiological reasons why your body is healing. We've helped people with everything from neck pain and tension, low back pain, sciatic issues, numbness and tingling, sinus issues, shoulder injuries, digestive issues, and even reproductive system issues over the many years of practicing NSA chiropractic. We know that chiropractic is one of the best ways you can stay healthy, feel your best, and have an awesome quality of life. With the traditional healthcare system in the United States, the solution to a symptom or health condition is typically a prescription drug. If that doesn't work, often more drugs are prescribed and even surgery. People have an amazing ability to heal themselves, and studies have shown that people under chiropractic care get sick less often, take fewer medications, spend less on medical care, and have a lower risk for the most serious health conditions like heart disease and cancer. Instead of giving drugs, chiropractic uses an inside-out approach to healing by improving the function of your spine and nervous system. If we break that down, NSA chiropractic specifically improves your body's internal communication system. When this happens, the body's ability to heal improves drastically. Let's break that down. The spine is composed of 24 movable vertebrae with corresponding nerve openings. Messages from the brain travel through the spinal cord and nerves to supply every single organ and tissue within the body with information. Your muscles, heart, lungs, liver, spleen, kidneys, everything. Because the spinal bones are movable and are easily influenced by stress, chemical tension caused by medications, pollution, and poor food choices, and physical injuries like a tough birth process, falls, sports injuries, or sitting at a desk daily, as changes to this structure become chronic, pressure develops on the spinal cord and nerves, causing dysfunction. According to the University of Colorado, pressure on a spinal nerve actually decreases its function by 60%. This continued decreased function may or may not result in pain, but does affect an organ's ability to function optimally. As information and signaling from the brain to the rest of the body becomes impaired, health is compromised. Let me give you some examples of how the brain sends messages to specific organs. So we're going to look right at the C1 vertebrae. The C1 vertebrae and nerve, that is right where the brain becomes the spinal cord. Every single message that goes from the brain to the rest of the body passes through the C1 vertebrae. This nerve also specifically affects the eyes, ears, nose, sinuses, as well as nerves that go into the head. If we go into the lower cervical spine, this area specifically affects the thyroid. It also affects the arms and hands. It also starts to affect the upper digestive tract. The thoracic spine, especially the upper thoracic spine, affects nerves that go to the heart and the lungs, as well as upper digestive tract. And then we get into the lumbar spine, where these nerves specifically affect the lower part of the digestive tract, like the intestines, as well as reproductive organs, and nerves that go into the legs and the feet. So this is what a healthy spine looks like. So when we look at an x-ray of a healthy neck, we see that there's a forward curve in the spine. That's what we're looking for. It looks like a banana-shaped curve. There should be spaces that are fairly uniform throughout the spine and nice smooth edges to the bone. Now we're looking at a neck, but if we looked at the lower lumbar spine, if we looked at a lumbar curve, it would look very similar to this. So if we go into the first phase of what a degenerative process would look like in the spine, what we see is a loss of a curve. Now that may take place after several weeks of tension on the spine, or that process may take years. But when the curve has been lost in the spine, what we see and what we know is that the spinal cord is being tractioned within that straightness. And so at this point, the discs start to become inflamed, nerve function is now affected. There may be symptoms associated with this, but we see many patients who didn't have symptoms of a decreased curve, but it was going on, and we detected it through the testing that we do. So we notice that piece of it. If we start to move into phase 2 of degeneration, what we see is that now this process of a loss of a curve has been going on for many years, and we start to see signs of osteoarthritis. When we see osteoarthritis, we see that often there's a decreased space for the disc, The bone has become jagged, there's increased bone being laid into the joint, and there's wear and tear that has often been happening for years. Now, patients ask me all the time, why is this happening? What I can say about why it's happening, or the most simple example that I can give you, is that if you had a subluxation or a misalignment in the spine and you continue to walk and move and live your life, but there was that misalignment happening, there's increased wear and tear that's happening consistently to that vertebrae. That is the vertebrae that will wear out more intensely than other vertebrae. It would be like driving on a car that was misaligned. It's going to wear out faster in specific areas. So if phase 2 has been happening for many years, that's when we start to move into phase 3, where the spine is actually fusing itself together. Usually between phase 1 to phase 2, patients start to have symptoms. They may have increased soreness, increased tension within their spine, but not all the time. So there are situations that we also see where phase 2 is happening and a patient had absolutely no symptoms. Dr. Scott and I have helped patients in all levels of situations. And because NSA is so gentle, we have helped children to the elderly and all ages in between to regain spinal health. Especially in phases 2 and 3, the spine may never fully correct, but it can function well, helping you to feel your best and to heal. As you can imagine, the longer the spinal issues have been occurring, the longer the spine may take to correct. But as the body heals, improved function and vitality return. As NSA allows function of the spine and nervous system to improve, it is common to see arthritic changes in the spine improve as well. When the spine then functions in a healthy way, further arthritic issues can often be prevented. Taking care of your spine is often overlooked, but patients who move to a preventative mindset for spinal issues have the ability to radiate amazing health for a lifetime. When spinal cord and nerve tension patterns exist within the spine for over a 3-week time period, the inflammatory and degenerative process start to set in. For this reason, we will recommend a spinal correction program, but recommend that taking care of your spine become part of your lifestyle. Just like exercise, brushing your teeth, and eating well are important, taking care of your spine improves your health, your well-being, and your longevity. The frequency of maintenance or wellness care varies by the individual and his or her lifestyle. The more stress management and healthy lifestyle factors are in place, the lower frequency the individual may need. Please visit the resources, blog, and events sections of our website at bodyandbalancechiropractic.com, as well as Body and Balance on social media platforms. We want to be a resource for you on your healing journey. Remember, health by choice, not by chance.